I could find out that something is wrong. I was always in tears, crying, sensitive, and sleepless nights. I have accepted that I'm suffering from major depressive disorder because I didn't get treatment at that stage. With depression, you always feel very sad all the time and hopeless and like nobody can help you and you feel alone.
In South Africa, mental illnesses and neuropsychiatric conditions make up the third highest burden of disease, and that is quite significant.
Mental health services have been chronically underfunded, both in this country and throughout the world.
By the year 2030, depression will be the most disabling health condition in the world.
The 50-year-old mother of 3 sons and a former teacher, Cathy Matthews, is one of those statistics.
I grew up in a very strict home and we weren't allowed to mingle with other kids. We didn't play much and do stuff that kids are supposed to do and have fun. Everything had to be perfect. And yeah, that is the way I remember my childhood. Never had really fun with other children. And I suppose, looking back at it now, that it is where the depression actually started, although I didn't know of that as a child.
Her life has been a living hell since the suicide of her first husband many years ago.
We were married only 1 year when he committed suicide, and it was traumatic for me, and I found him with a bullet hole through his head, and when I came in with my little boy and we saw that he was lying there. I went on as if nothing was really wrong. I was sad inside, but outside I had to show the people that it's fine, that I'm coping, but obviously I didn't. Today, it's almost 30 years after that. I have accepted that I'm suffering from major depressive disorder because I didn't get treatment at that stage. And 3 years after that, I married again. Only during that marriage, I could find out that something is wrong. I was always in tears, crying, sensitive, and sleepless nights. I think we were married about 5 years when I went back to the teaching college to because I wanted to finish my studies in teaching, and that's when I had a breakdown, my first nervous breakdown. But after that, doctor diagnosed me with major depressive disorder, and I was on tablets and things were okay, like I was growing up, showing the outside world that I am coping. And a few years after that, in 1995, I committed suicide myself, which left me for dead. That's why I say committed. And before I took that massive overdose of a shoebox full of tablets, I prayed to the Lord and asked Him to forgive me. But I am so tired and lonely, and I couldn't be living here anymore. So I wanted to go home. That's what my prayer was. Please forgive me, but I want to come home. I want to be with you. After a week on life support, the doctors decided to ask my husband to switch off the machines. I started breathing on my own, and after that I could only communicate with God. I asked Him, what is the purpose now, and if He will restore me, help me to restore me back to health, I will tell the people about the illness and about what God is able to do. 1 year I had to, was like a baby. I couldn't speak, I couldn't talk. I had to learn everything from scratch, and that's why I have the stutter, because that is all the symptoms that I couldn't speak, so I had to learn my first language first, obviously. It was our home language, which is Afrikaans. What I have left over is the shivering in my hands. And then I'm not so mobile on my feet. People might think that I'm not stable.
As a teacher with medical aid, Cathy had better access to treatment. For the majority of people, this is not the case. Exactly a year ago, Cathy started a support group linked to the South African Anxiety and Depression Group. They meet once a month. Cathy says a great number of people are not getting the care they need, and she does breach counseling for patients who are on the long waiting list for treatment at state hospitals.
If it goes on for more than 2 weeks to a month, then you must know that that is definite signs of depression, and you must seek help.
Cape Mental Health is a non-profit organization that provides community-based services to people with mental health problems. Director Ingrid Daniels says it is difficult for ordinary people to access treatment.
1 in 4 South Africans have access to treatment. It is alarming, it is very concerning, and in fact it is in line with the World Health Organization statistic of 75 to 85% of people who are living with mental illness have no access to mental health services.
As you can see, it says maladjusted on the front. And on the back,
Dr. John Parker is a psychiatrist based at Lentegeur Psychiatric Hospital. He is also deeply concerned about the state of mental health care in the country.
There are a huge number of people suffering from quite severe mental illness in our communities in this country. The trouble is they remain hidden. The real drivers for mental illness are the sickness in our society, and we can see that sickness in crime and the abuse of women and children.
We visited Clark Estate on the Cape Flats, a working class community. Crime is high and domestic violence is common. Sheila Ann van Niekerk suffered for many years at the hands of the man she loved.
Hy sal kom van sy drinkplek af, van sy vroumense af. Hy sal die goed in die huis rondgooi. Hy sal my slaan, hy sal my kop vat en teen die muur kap. Dan help ek uit by die deur.
The constant abuse led to severe depression. Sheila Ann struggled with her condition and often had to wait long for treatment and medication. One night she locked her husband out, desperately trying to escape further abuse. While breaking a window to get in, her husband cut one of the arteries in his arm and was rushed to hospital.
Toe het hulle nood toegepas, maar hulle kon nie sy lewe gered het nie.
For many years, she blamed herself for his death, leading to more depression.
Hoekom het ek hierdie idee opgemaak? Is my skuld. En ek het so een dag, toe kom het by my. Sy het dan al die pad gebid en vir die Here gevra. Die Here moet jou verlos. En is op die manier wat die Here gekom het en hom gekom haal het. En het bietjie by my gespook, maar nie meer nie. Ek het vrede kom vat daarmee.
She says after years of treatment, she's finally coping.
It's the poor who suffer the most from mental health problems. The rates of anxiety and depression are much higher among poorer people than among wealthy people. Things like tic or methamphetamine is a huge driver of admissions to acute psychiatric emergency services in the Western Cape especially. And you'll find substance-related psychosis is very high on the list of diagnoses for people admitted for acute psychiatric services in South Africa.
And my eldest son became a drug addict. And it was traumatic for me.
I was a drug addict for 8 years, an active drug addict. And it was a fight to stay clean and to live a sober life. I always blamed my mother.
And I believe the reason that he went and became a drug addict because I wasn't there.
Until I had to surrender and know that it isn't their fault for the things that happened to me. I really had to deal with things in my past. I really need to accept the fact that I'm an addict and that I have a problem. And by that, the healing started. I went to a rehab center, and I also had an experience where I could only just give God all the praise and honor for my life.
At least 1 out of every 6 people develops a treatable mental illness in any year in this country, and probably 1 in 3 in their lifetimes. So that's a huge number if we take the population of South Africa. What's it now, 45 million? We're talking millions of people, and the impact on the economy is immeasurable. The most scary thing, though, is that mental illness is on the increase.
Cape Mental Health held this demonstration in the heart of Cape Town to highlight the lack of resources and funding for people with mental illness.
Our demonstration today is a call on government to make mental health a priority.
When we look at the budget allocation for the provision of mental health services, on average, only 4% of the health budget is spent on mental health. That is a great concern, considering that mental illnesses and neuropsychiatric conditions is the 3rd highest burden of disease.
We can't possibly deal with all of that with a few centralized mental hospitals like this one. Mental health services have been chronically underfunded, both in this country and throughout the world. The problem was we always have measured the impact of disease in terms of mortality. And only recently we've realized the real impact is on your productive life.
This is Lentegeur Psychiatric Hospital in Mitchells Plain. Like all other state facilities, seriously understaffed and underfunded. One of the nurses agreed to talk to us as long as we don't disclose our identity.
During the night, at least during the day, is better than the night, because the night has only got 3 people who's looking after sometimes 40, 50 patients, 57 patients. And 1 security, and the psychotic patients. And the more restless when the ward, especially when the ward is overcrowded, they become more psychotic and restless.
The mental institutions are severely understaffed, and our members suffer as a result of the pressure that is placed on them.
But only 30 beds in 16B. But when it's overflow, you must reorganize the mattresses for them. I think ever since June till now, this year, this thing has been ongoing. And we even said maybe it's not going to stop, because now it's now about more than 3 months now. We don't have winter nighties for them, we don't have pajamas for them.
If the government can address particularly the issue of understaffing, that would relieve a lot of the stress.
Although the situation is far better in the Western Cape and some provinces, most mental health facilities in the country remain both severely understaffed and underfunded.
We've only got a 5% vacancy rate in the province, while it's more than 50% in the country. So we're actually very fortunate that we don't have a severe staff shortage. The biggest problem is the increase in the disease, the burden in the disease, which is growing. And obviously resources can't always keep up with the demand.
Professor Krieg Lund serves on an advisory committee to the National Health Minister. He says the shortage of qualified public mental health care professionals is critical.
There are approximately 1 psychiatrist for every 360,000 people in the public sector, and about 1 psychologist for every 312,000 people. So that really isn't enough to meet the needs of the country.
We know that only 14% of trained clinical psychologists are found in the state or public sector mental health services. A study has also indicated that there are only 3 psychiatrists, 11 psychiatric sisters, and 3 social workers allocated to every 1 million of the population.
It has a huge impact on the country's economy. So we did a study which found that there was around 30 billion rand of lost income associated with people with mental illness.
Whereas the cost to treat people only at the moment is 480 million rands. So clearly there's a disjuncture here. Here's a problem. All people with mental illness want is to have access to services that will help them to be well enough to contribute as citizens of this country.
We've been going through a process of developing a national action plan for mental health. But it's basically in process. About 3 weeks ago, the National Health Council, which is the main decision-making body within the Department of Health, formally adopted this new mental health action plan.
We believe that a task group was established and formed to address some of these alarming gaps. 16 months later, we are still waiting for feedback about how the government intends to now address the problem.
And I think the key stumbling block is provincial health budgets, because that's where the decisions get made about allocations to mental health. And unless the provinces take action and actually adhere to the national policy, we'll see the same pattern repeating itself again.
We are increasing year on year our budget. It is not enough. With the current demand, we cannot keep up. But at least we are allocating more funds and we're trying to do our best. What we are placing a lot of emphasis on is to renew facilities, to be modern in terms of the latest technology and methodologies for treatment. That's why we, for instance, going to rebuild the new Falkenberg Hospital. But we're also investing a lot in prevention programs.
The sunbird.
Dr. John Parker is trying very hard to bring change at the Lentegeur facility. He started a program called Recovering the Meaning of Lentegeur.
If we translate that name, it is really beautiful. Lente, spring. Geur means the scent or the essence. I mean, what more beautiful metaphor could you ask for than the essence of spring? So spring, it's about rebirth. It's about getting in touch with your roots as you blossom towards the sun. It's, for me, the epitome of hope. It's what we need in this country. We need a new vision of rebirth, of spring, of coming alive, believing in yourself. And that's really what the project's all about. So when this project's really going, those vast empty spaces will be transformed into gardens, into areas of natural bush that have their own beauty, but also into fynbos gardens that can be harvested, the flowers sold to places like the hospital next door, vegetable gardens that obviously are productive in themselves. But I believe that will entirely transform the atmosphere from one that is stark and isolating to an atmosphere where you feel tranquil, where you feel like you belong. We've got an arrangement, a partnership with the catering company, the private partner who does the hospital's catering, and they will be buying the food that the patients produce. Obviously, it will be very much cheaper because it's right on our doorstep. It's very healthily produced food because it's all organic. So with that and with our energy saving plans and so on, suddenly the bang for every rand put in here, the payback for every rand that the health department invests in the hospital will be so much more, because we're letting the budget go further using a whole lot of pro-environmental methods that actually save money in the long run. When we give people a skill and a way of developing something in the community, we give them the opportunity to actually become productive.
Lord, we thank you for your love, for your peace, We thank you for your provision once again today that you provided for us, O Lord. Lord, come and bless each and every piece that you put in our plates today. In the mighty name of Jesus Christ. Amen. Or at least for us, as the family, the husband and the kids, most of the time we actually don't understand what's actually happening. But all we know that she's suffering of depression and anxiety, and she got the attacks. But we know more or less now how to handle it. Most of the time she wants actually us to be on a distance, and then we rather keep quiet, just be around or whenever she needs us. It's actually putting me also in a stressful situation, but I know how to cope with it.
After years of treatment, Cathy Matthews is finally coping.
We started to do things as a family and to appreciate each other.
How's your happiness now? Are you happy now, right now?
Yes, I am. I can honestly say I am.